Now, a recent incident at Standard Bank where an employee fell to her death from the 7th floor has brought mental health in the workplace into sharp focus. The tragedy coincided with World Mental Health Day and has sparked debate on how work-related stress is handled. Joining us to tell us more about the tools that can assist with mental health is Dr. Paul Soko, who is the Chief Medical Officer at Life Mental Health. Thank you so much for joining us this evening, and a very good evening to you.
Good evening, and thanks for hosting me on behalf of Life Healthcare.
Now, the news of the Standard Bank employee who fell to her death came as a shock as well. But what doesn't come as a shock is the kind of mental health strain that employees find themselves under. Do you find that corporates, organizations are putting enough resources and energy to prioritize employees' mental health?
Definitely. In fact, within Life Healthcare, we've got an occupational health subsidiary that primarily deals with employee wellness. And I think in the recent past, we have prioritized mental wellness of most of our clients who are employers. And I think the latest data that we have, Mas, has indicated that in the last 10 years, from 2015 right up to 2024, the number of members that are assigning themselves to chronic illness benefit on mental health for various medical schemes has in some instances increased by 40%. And if you were to cut down that period maybe to before COVID-19 right up to now, most of the medical aid schemes are reporting almost a 9% increase in mental health illness benefit that are accessed by their members.
And that's great, and this shows a step in the right direction as well, while we have those initiatives too. But it does seem that the problem still remains because the pressures, the work pressures still remain, and in some instances are even exacerbated, where you find employees complaining about toxic work environments, for instance.
Yes. Absolutely. And obviously, the pathophysiology of mental health is multifaceted. We are living in very difficult times with the pressures of modern society. You know, there's geopolitical tensions globally. Each country has got its own challenges. We are faced with gender-based violence in this country. We are facing with what are called crimes of the new dispensation, extortions, and so forth. And also in the workplace, there's a lot of pressure in terms of performance and output. Coupled with that, some individuals are facing tough challenges within their home and community environments.
And when you're talking about the mental health questionnaire, the stats that you were giving as well, which are looking also promising, should we be not necessarily celebrating, but also basically a little bit more enthused when we know that there's more access that is given, but should that also be coupled with working with organizations as well?
Yeah, absolutely. And I think the stats that I've just mentioned are talking about two things. One, I think there is currently heightened mental illness awareness in the general population, and it explains why we are beginning to see so many members enrolling for chronic illness benefits. You've mentioned that the mental health questionnaire, which currently we use within Life Healthcare when we admit patients for acute admissions. We measure the mental health score at the beginning of the admissions, and we measure them at the discharge to make sure that there's actually been a health gain in terms of the patient feeling better.
And then thereafter, is there then monitoring of that patient as well to make sure that it is effectively addressed as well?
Yeah, so that tool, Mental Health Questionnaire 14, is actually an international tool which has got its root in the World Health Organization. It has got 4 pillars to it that does almost a 360-degree evaluation of the patient on admission. The first one is what we call the vitality domain, which measures the energy level in a patient. The second one is about emotional stability. So there are about 4 or 5 questions that talks to emotional stability of the patient. And then the third domain talks to the mental health or status of that patient. And I think the fourth one, which is the most important one, and it's often the reason that triggers an admission to acute facility, is when the patients are socially impaired. In other words, those three domains are so severe that the patients are not able to function either at home or at work. And then we do the scoring at the beginning of that mission, and we do it again at the end. And what I want to emphasize, this is a patient-reported outcome measure. So we give the patient survey, they fill it in themselves, and we score it at the end. And it's a two back-to-back pages. On discharge, we turn it around, repeat the same questionnaire again, and we measure the health gain that will ensure that the patient has actually recovered.
Yeah, and also speaking of that monitoring as well of that patient, looking at the demographics and gender as well, when we're looking at that, do we have a pattern of the kind of profile of patient?
Yes, absolutely. So currently in our data, 60% of our patients are female and 40% male. And I think that slight discrepancy, we associate it with the fact that females tend to seek mental health more readily, as opposed to males that sometimes may feel a bit weak or undermined to go and seek mental health. But our view that in the general community out there, the gender parity is probably on par.
Yeah, and of course we have to bear in mind gender roles historically as well, and cultures as well. When we think of old sayings like, you know, men don't cry as well, that also plays into
Absolutely.
this. Do you find that there's been more of an effort to try and get men into checking out their mental health as well? And how is that received as well by their family, friends, community?
Yeah, so I can only comment about the life healthcare employees that we do reach out to both. I mean, predominantly in our business, it's dominated by females because it's a nursing clinical service, but we don't discriminate when we reach out and we drive employee wellness. We tackle both males and females alike. And I've realized that also the National Department of Health in their mental awareness weeks, they do target the male population also to make sure that they do come forward before it gets late. Because quite often, Masa, we forget that by the time a patient develops suicidal ideation and some of them successfully commit suicide is because we were delayed in terms of making the right diagnosis and effecting the proper treatment timeously. And as a result, suicide becomes like a complication of a poorly managed mental health condition.
Yeah. And I mean, Doctor, speaking of suicide as well, I mean, how important is it to have these kinds of statistics as well, these kinds of studies, and being able to actually measure the work that's being done to try and help?
So Masa, what we do within Life Healthcare, for example, I mean, we've mentioned the mental health Q14, which is a patient-reported outcome measure. But there are two key things that we assess when we admit patients with mental disorder. Largely because it's a big clinical risk for us. The first one is patient falls. So generally, because these patients tend to be on psychiatric medication, some of them causes drowsiness, and they tend to fall. So we do screen on admission the high-risk population, and we monitor them appropriately. The second thing that we do is a suicide assessment, and those that they score high risk, we tend to put them on what we call a suicide watch. And as I indicated at the beginning, that suicide is a complication of a poorly managed mental health disorder. The sooner you diagnose it, the better, and then the more you are able to deploy appropriate treatment plan for the patient, which is generally multidisciplinary, including the psychologist, the psychiatrist, the community GP, as well as the occupational therapist, to make sure that the patients are able to come out of that suicidal ideation.
Thank you so much for having this discussion with us, Dr. Paul Soko, who is the Chief Medical Officer at Life Mental Health.